Welcome to Global Products MURx Orthopedic EHR and Practice Management Software. This is the login page for MURx. After we log in, this is the main dashboard with shortcut panels for quick access to the different parts or modules of the software. To view the orthopedic OPD page, click on patient to consult, name of the patient. This opens the patient chart. The topmost part displays the patient details. Next is the face sheet, which gives a brief information about the diagnosis, allergies recorded, medication given. The orthopedic EHR or the OPD starts with the anatomic approach. Clicking on the anatomic approach tab shows the different anatomic approach and the corresponding interval muscle nerve findings, which have been given in a drop down format just for shoulder, and the corresponding interval muscle nerve finding. Summaries, if any, can be entered in free text format. Next is the proximal humerus, the elbow, forearm, the wrist, pelvis, hip, femur bone, the knee, the leg and ankle, and the findings for interval muscle nerve for each of the approaches for each of the joints. This is for elbow, the forearm, wrist, pelvis, hip, femur bone, knee, leg and ankle. Then there are some special tests. Clicking on the special test tab, the inspection, swelling, atrophy, deformative symmetry, palpation, range of motion, neurovascular assessment and special tests. The description and summary can be entered in free text format. Next is the fracture description, the integrity of skin soft tissue, the location, fracture pattern, displacement, blood loss. The fracture image incorporated or shown displayed in the software can be edited using an image editor. Again, descriptions and summary can be entered in free text format. Next is the spine injury. Clicking on spine injury tab, compression injury, flexion injuries, extension injury, rotation injury, Jefferson fracture. Selections can be made from these drop down lists. Atlantoaxial and dense fractures, C2 fracture, fractures above C4, fracture in the middle of the cervical spine, thoracolumbar trauma. Then coming to the neurologic exam, again there are selections which can be made from the drop down list, such as dermatomes, myotomes, central cord syndrome, Brown Sequard syndrome, anterior cord syndrome, conus medullaris syndrome, and the cauda equina syndrome. Again, descriptions, selections can be made from the uh, drop down list for the respective examinations, and the description and summary can be entered in free text format. It can be recorded. Next is the joint. Joint examination, anatomic position and planes of the body, flexion, extension, abduction, adduction. These images can be edited using an image editor and markup can be done. Next, coming to the knee examinations, the observation types have been mentioned, and the observations and summary for each observation type can be entered in free text format. The observation types such as various deformity, surgical scars, obvious right knee effusion, range of motion, ligaments, normal anatomy and function, medial collateral ligament. The image of the knee is displayed or shown. In summary of maneuvers, knee exam, you can select from the checkbox the appropriate name of the maneuver. Clinical observation has been mentioned and remarks can be entered in free text format. And select from any of these. This is the knee examination chart, and then the last one is for the shoulder examination. Data can be saved in this part. The observation types have been given and the observations and summary can be entered as previously in free text format for each observation type. So observation and palpation, active range of motion, passive range of motion, the rotator cuff, and we have the shoulder image, and then the summary of maneuvers for shoulder exam. Again, the name of the maneuver can be selected by clicking on the check boxes, and the remarks can be entered in free text format against each. This is the shoulder examination and the patient chart and the details for included in MURx for the orthopedic specialty. Thank you.